Welcome back. We are taking a closer look at high-intensity focus ultrasound, a non-invasive procedure that is gaining attention for its ability to treat a range of conditions. Joining us this morning to tell us more is Dr. Patrick Senatis, a neurosurgeon at the Hartford Healthcare Eye Neuroscience Institute. Doctor, thank you for your time.
It's a pleasure to be here.
Happy to have you. Let's first talk about what this high-intensity focus ultrasound is. For those who don't know, please explain.
Yes, so high-frequency focused ultrasound is an MRI-guided procedure where one focuses about 1,000 very weak beams of high-intensity sound waves to a very precise point where we can make a lesion to disrupt abnormal circuitry that causes movement disorders.
Okay, so who are the best candidates, would you say, for this kind of procedure?
Well, the candidates, patients with essential tremor and Parkinson's disease are the most common candidates, and there are some experimental, other conditions that are being investigated.
And you talked about how this ultrasound works and how it can really target a specific area, but how does this type of treatment really benefit the patient?
Well, patients will come in oftentimes with intractable or uncurable tremor, which can really disrupt their lives in a lot of ways. It could inhibit them from achieving their usual activities of daily living and achieving, things that they want to do. And so what this does is it very effectively treats these tremors and these unwanted movement symptoms and allows the patient to get back to more normal life.
Oh, that's wonderful. Can you just explain, too, the difference with this new ultrasound versus, what people have been, or how people, rather, have been treated for years? What's the difference?
Yeah, besides, obviously patients will be treated with medical management, physical therapy, and medications. And recently, deep brain stimulation, has been used to treat tremors. The high-frequency ultrasound is an incision-less way of achieving that process. It does create a lesion, but it doesn't require the implantation of electrical or electronic devices within the body to treat the tremor.
Very interesting. And I know to talk more and to learn more, you do have a webinar coming up, not this Thursday, but next Thursday, January 23rd. What can people expect during that conversation?
Well, I do encourage people interested to see it. They will. We will describe patients who are candidates or how you become a candidate and the process that you have to go through to become a good candidate. They will see the procedure, at least the steps in the procedure, and we'll be able to answer any questions that they have.
Wonderful. And all the information is right there on your screen. Doctor, thank you for your time and the work that you do.
Thank you so much. Appreciate being here.